I was wondering, I mean, you had some terrible time, I guess, with having the coronavirus. How was that? Did you get a lot of pain or?
It was, I would say, probably a mild, although maybe a significantly mild case. I had headache, leg pain. Most of it was mild, except that I had shortness of breath for a number of nights, and that's where it got a little scary because I've got some asthmatic conditions. So,
Okay.
I've read in the news that that can be an underlying condition that leads to more severe complexities, but it didn't in my case. After a few
Okay.
nights, cleared up. Yeah, I'm back. I've got a clean bill of health now. I'm good to go. I'm still here in the quarantine area. Hey man, it's better than the hospital, and Vietnam is doing very well compared to a lot of other nations. So good for them.
Yeah, well, in Europe, things seem to be calming down a little bit, at least in several countries. I'm hoping that in a couple of weeks, at the end of the month, beginning of May, that things will be a little bit better in the Netherlands and that some business will start running. Although I have to say, in Holland, we have the what they call a smart lockdown. It's not that everything is completely closed. They do give some freedom to the people. We can go outside, we can walk, we can go to the supermarket, even go to a park, as long there's a distance of 1.5 meter. So like museums and those kinds of things, obviously they're all closed. At a certain point, if there's a lot of people on a certain place, then the local government can say, okay, we're going to close this. But it's still okay if I compare it with our colleagues in Spain or
Mm.
in Italy, where they're completely stuck at home. So here there's some kind of freedom of movement still. Yeah.
Well, speaking of which, I mean, you were supposed to be my last meetup in Europe. You were the last
Right,
one, and it didn't happen because you were kind of sick and things were getting a little hairy. So my wife made a booking earlier for me.
right,
Good thing we didn't meet, man. Otherwise,
right.
I would have
And I
been
told you,
much iller.
that the ladies, they're always right. So your wife, she was right. She said, Matt, you have to come home now. Well, listen to them.
Probably I should have
Well,
listened a week earlier, but what do you do, you know?
yeah. Well, next time, nobody knows if the ESCRS will take place or not. It will be in Amsterdam. Hopefully, we can catch up then, and then I can show you some things around in the Netherlands.
Hey, well, let's make it happen, Tiago. Let's commit to making it happen. We're
Sure.
going to do that, and we're going to kick off ESCRS the right way this year, for sure.
Right.
Or we'll hope, we'll hope. So, well, tell me more about what's happening in the Netherlands vis-a-vis ophthalmology. You could also speak about other parts of Europe,
Sure.
but what are you guys finding out there from your perspective at Optech?
One of our main concerns is obviously our people, that they're healthy. So we need to ensure that they can work on a safe environment. I think that's very important. And another thing is obviously these are also times where there's economic problems. They will arrive. So we have to make sure that these people will still working with us. So that's the main concern. Keep our colleagues healthy so that they can work, ensure that they can keep their jobs, that we can keep all of us our jobs, of course. Yeah, I mean, that's very important. And next to that, we try to work to help in fighting this coronavirus the way we can. I mean, there's not too much that we can do except follow the rules of the different governments where we are present, but we try to help by giving away masks where we can or by giving away protection glasses. And there's a lot of hospitals where the ophthalmology department is closed. I mean, all of them are closed, so we can't
Yeah.
just go to the hospitals, we can't make visits. We need to find other ways to keep people in contact, to follow up on different topics that were going on. We use teleconferences like we're doing now, obviously. We try
Sure.
to motivate and teach optometrists, our own people, surgeons in certain techniques. We do it online with webinars, conference calls. So I think those 3 points are important. Our own people, the safety of them, keeping their jobs, keeping them safe. On the other hand, try to help fighting this coronavirus any way we can. And last but not least, we need to keep up the contact with the ophthalmologists. I mean, there's a lot of conferences, and you know it as well because you would be present at many of them that are canceled. I mean, so those are very nice moments of contact, and those are gone, right? So everybody has to be creative, and I think the ophthalmologists are very creative. I see a lot of webinars going on between peer-to-peer, and I see here and there the companies are doing also some webinar and exchange of information. So we're doing that as well. I'm sure it will open opportunities to do business also in a different way. Because one important aspect that we all need to think is how it's going to be the life of a manufacturer, in our case, intraocular lenses and surgical devices. How is our life going to look like after the corona? It's probably going to be difficult to just get into a hospital and be next to the surgeon and help him or help her on a certain surgical procedure, which we do a lot. Can we do that? Is it even possible? Are there going to be demands from the hospitals, from the surgeon self? So I think we're coming into a new era where the future is unknown, with a group of people thinking how to go further after the corona. I don't think it will be business as usual, but there will be some differences in how we conduct business. So there's something that is keeping us busy at this moment as well.
Well, Tiago, if you need some customized personal protective gear, we're of course in Vietnam. So if you need some protective wear with bananas, something like that, no problem. We'll ship that right over to you.
Thank you. I appreciate it, Matt.
Sure.
And I might just take advantage of it. So be careful. You never know.
Well, we were thinking to maybe make some masks,
Do it.
but maybe
Do
some
it.
designer mask or something like that, because you
Well,
see all over the world, it's very commoditized, but it could be a nice way to engage with people with a colorful mask.
well, our colleagues in Portugal, the Oftec Portugal, is already doing some personalized masks.
Cool.
So I think to do it as well, yeah. We might do it as well in the Netherlands. So I think it's a nice idea. Why not? I guess we have to be creative on these moments. And a lot of the salespeople there at home, they can't do much. So they need to be creative. They need to think on ways to get in contact with their customers and motivate them, obviously, to look into the advantage of some of our products. And how do you do that if your contact is limited? We need to be creative, all of us.
Did you sit in on the WOC seminar the other day about the virtual show?
My colleague did. I had some glances of it and it looked very interesting, I have to say. I mean, I guess the WOC is right. How are we going to do this in the future? Even the ESCRS, if it's going through this year, which I hope it will, can we stay with 10,000 people altogether? Because that's how big the meeting is. I don't know if that's going to be possible. And if it's possible, I don't know if everybody wants to do that. Maybe it's a too bigger risk to have so many ophthalmologists in such a space. If something happens, then we all have a problem worldwide. Also, the future of congresses, media congresses, they might take a turn now. I don't think that personal contact is going to disappear. For sure, it's going to be different. What do you think?
I thought it was very innovative that the WOC takes the path that they are doing. And that was, by the way, the other meeting that I had in Amsterdam was actually the final in-person meeting that I had. The fact that, you have a lot of other conferences canceling or postponing, they're the first one that I know of that's taken this virtual path. So they're kind of trailblazing in that area. And I'm sure there will be a lot of learning to that. But you have to figure, first of all, they say they still have 4,000 registrations for their virtual show. Mm-hmm. They're hoping to double that to about 8,000. And regardless of whether they do or not, at the moment, they have a bit of a monopoly. They're the only game in town until something in person happens. So I think for all of us out there that are going on these mini webinars, that are trying to do, the virtual handshakes and high fives, the fact that they have taken it beyond and not only combined the webinar with the virtual exhibition, I figure we got to get behind them and try to support them, and good things happen to those who innovate. So going back to masks, you were mentioning you were going to donate some masks to healthcare providers. Is that right?
We had a very limited number of masks available. So what we did is that we made them available for the local hospitals here. It's not a huge significant amount, but it's what we could do. And we had also a lot of goggles, protective eyewear, which we donated. Again, it's small amounts.
We all do what we can, though.
Oftech is no different from the Dutch government. If we would want to buy those masks, we would have the same difficulties as they are having, obviously. So there's just
Sure.
this car on the problem, on the product. There's not enough of the product in the market. So unfortunately, we don't manufacture them, so we can't help on that way.
How do you see manufacturing changing, if at all? I've been reading articles about companies possibly, manufacturing things more in country after this all goes away, just even to serve the national interest in times of challenges. Do you think that Optech will do anything different with its manufacturing facilities?
I think in our case, it's not an easy process to open a new manufacturing plant. It has a lot of regulatory work behind it and a lot of costs. For us, I don't think it's an option, at least on the short term. Maybe on the long term, I don't know. But at this moment, that is not something we looked at. And if you think about it, Matt, a lot of our business is in Europe, and Europe is like the US, right? I mean, if you look at the size of Europe, it's like one country, it's one state in the US, or not even, sometimes 2 or 3 countries, it's a state in the US. So on that perspective, going national, having a plant in the European Union is already like being a nation, I think. And it's like having a plant in the US, I would think. So, but no, that's not on the back of our heads, at least that I'm aware.
The ophthalmologists worldwide now, it seems like they're also, a lot of them are at home, but there are still emergency surgeries that need to be done in ophthalmology. Your lenses are more elective, though, I think, right?
Much, I'm working from home, and when you work from home, things like this happen. I'll show you.
Oh, it's perfect. What's going on here in quarantine, Thiago?
So this is one of my 3 kids. They
Oh,
all
hey there.
have a name that starts with an F. So Florian, Ferdinand, Francisco. So I call them the 3 Fs. This is one of them.
Yeah.
Say hello to Matt. He just came along. So I'm sorry for that, Matt, for our interview.
Oh, that's okay. Thanks for joining us.
But see, there's another of the challenges of the corona and working in a different way.
It is.
And the good thing is that people understand that from each other, because it happens to me when I'm talking to surgeons, some similar things, right? That you're in a meeting and sometimes there's a cat. So, okay, that's unusual. A cat's jumping, But this kind of things happens when you're not in the office and you have people around you. And I'm happy to see that the people accept it and take it with a smile like you're doing it now.
Yeah, my method in our industry has always been to get very personal with people. I love that. Maybe now more than ever, we all have to understand and appreciate each other more now than ever. That's okay. Yeah. We don't have to put on a business front all the time. We can be humans too. I would say that Optech would be in the refractive business, right? But when you have different specialties, glaucoma, retina, I could see certain subspecialties recovering. But with refractive, I could see it maybe taking a little longer, possibly, just because maybe it's not as required as other types of ophthalmic procedures. But I don't know. What do you think?
That's true, but that's the good thing about Optech, because Optech is not purely only a refractive IOL manufacturer. We do have the Artiflex, obviously, which is a huge brand worldwide. One of the most refractive procedures are done with Artiflex lenses. On the other hand, we are also one of the few companies that provide trauma lenses, which is a niche market, very small. But those surgeries are going. So think about eye prothesis, patients that have an accident and something happens to their iris. They need to reconstruct the iris. So we're on that business as well. And also we're leading on that spectrum. And next to it, and still looking at special cases and traumatic cases, you see a lot of patients with subluxated IOLs, patients that have problems during cataract surgeries or after the cataract surgery, and they have zonular problems. I remember you even wrote a few years ago something about ZD, zonular disease. And also for that, we have a solution, which is the Artisan aphakia lens. So yeah, we're leaders on the refractive surgery, but we are also participating onto the specific markets of trauma, right? By doing iris reconstructed iris, and by doing as all the Artisan lenses. So in that way, our business can be a little fast as well.
Hey,
Number 2 is coming.
Okay. It's just like I think I saw something on CNN one time, the same sort of thing.
Sorry.
So now this is like the CNN episode that's happening in ophthalmology. I'm
And I
loving it.
have
I'm loving
three of
it.
them, Matt. So we have a visit of number 2. So maybe number 3 still comes. I'm sorry for that. Maybe you're
Oh,
gonna have to do some cut-offs on your interview. I'm sure of this.
I'm gonna make this the highlight. This is gonna be all what happens in quarantine. And if your kids ever make it to Hollywood, you'll know they got their start here.
Yeah, exactly. By Medium Eyes.
Yeah, there you go.
Well, you have something on your shirt. You can actually read it
can you read
unreal, or you can read it like Los Angeles, LA, earned you, something like you.
Yeah, I mean it reads Unreal, but it's even the lettering is kind of twisted. So that's the whole point. We are in an unreal circumstance, and things are a little twisted, but we make the most of what we can.
So that in terms of the business, Matt, yeah, sure. The refractive, it's the business that's probably going to take longer to recover because it's not necessarily straight away. Although if you see people that have huge myopic problems with -10, -11, -12, in some countries it's seen as a disease because you can't properly work by having such a high myopia. But we're also on the cataract and the trauma business, so that will recover, I think, a little bit faster.
I wonder if the conversations in ophthalmology will start to change as well, because we got to a point where we were talking so much about femtosecond lasers, about these refinements in the refractive space, really for people. I mean, to the point that maybe it was even becoming a bit of an aesthetic surgery in a sense. But perhaps we'll be getting back more to, as you said, issues that are really basic human needs, things like trauma, for which, again, you have this product for. I'm curious about how the conversation in ophthalmology will evolve. Do you think it will evolve?
Yes, but I don't think that we will stop doing what we're doing now. Back in the beginning of OffTech, and where I was not in the company, but at the beginning of ophthalmology, you see, I mean, you had an IOL that was manufactured by us or by Rayner at the time, and you have a 22 diopters. That's it. So you had an IOL. You don't need to do anything else. The IOL was at 22 diopters, and right? From there, you evolved to diopters, half diopters. There's companies that do quarter diopters. We look into patients' aberrations. So we try to be more personalized service to a specific patient. So in a way, yes, it's going to go on the direction of what you say to the most basic needs. But on the other way, I think it's going to be very high tech, but it's going to be on the basic needs of a specific patient. I think you're going to be looking at Matt and you say, okay, look, Matt on his left eye is going to need to correct an aberration of, minus 0 point whatever, and he has an astigmatism that is obliqual, so we need to make an IOL or another product that will be specifically for you. I don't think that the path of innovation and going forward, it's going to stop. But one thing is linked to the other because it's going to be more concerned about a specific patient, and not so much for the massive, like you're saying, let's just do a cataract surgery, and it keeps on going. So it's going to be more and more patient specific. So it's going to take more time for the surgeon to evaluate that patient, to the optometrist, to the manufacturer to make the right product for this one patient. I think that's the way where we're going to evolve.
I heard some talk from an ophthalmologist in India. I haven't verified this, but it sounds like the government agencies there are really taking this as an opportunity to enact methods which would cut down on the markup that both international and domestic companies could have on things like IOLs, but really all medical products in India, and I wonder if, again, it could squeeze the segment of premium in what already was a country where margins could be thin in certain categories. Do you think that this pandemic will change regulations around the world in terms of how ophthalmic products are distributed?
It could, and it's going to depend obviously on which part of the world you're talking about. But if you think about Europe, next month on the 26th of May, the MDR should be implemented. So the MDR, it's something more or less equivalent to the standards of the FDA, which are very high. So we're actually already on that path. Since the problem with the breast implants in France, that the European Union start all this massive project for medical devices regulation, which we're in at the moment. And theoretically, we should be applying it as from the 26th of May, if I'm not wrong. But what I hear now is that due to the corona issue, that they're probably going to postpone that for certain time. We don't know exactly.
Okay.
But yes, we're going already on that direction, and it might be curious that because of this, they might soften up the rules. I don't know. I'm just saying it. And the other thing that we don't know about the coronavirus is how many companies and also ophthalmic companies will survive the crisis. You must not forget that, for instance, I see here in our company, the sales are obviously very small. It's obviously if you're dedicated to ophthalmology and if you're doing intraocular lenses and if there are very few or none surgeries being done, your sales are also close to zero, right? So you need to be a strong company in order to keep paying your bills, paying your people, your suppliers, keep the manufacturing process rolling, raw materials, all you can imagine. That still has to be paid. And I don't know how healthy or not healthy some companies are. I don't know. But I can assume that some companies will have a huge problem.
Yeah.
That plus the MDR in Europe, at least inside Europe, the new MDR regulation, that could be a very big burden to some companies. So it's going to shape for sure the industry. I don't have a doubt about that.
Yeah, I think you were kind of getting at the issue of cash flow there a moment ago. And I have heard that that's going to be a huge issue. Well, it's not just ophthalmology, it's not just medicine, it's everywhere for every company. You know, what are your thoughts there? I heard, for example, distributors for some reason in Asia Pacific are particularly maybe going to have a problem with cash flow for certain business reasons. Do you have any speculation as to, what types of companies that would affect the most or what regions, anything like that?
The only thing that I can say is that what everybody knows, and you just said it, independently of the industry, it's going to be difficult as the longer you stay on the lockdown and the more countries are on lockdown, the worse it gets, obviously. I don't want to speculate more than that. I don't know.
Well, I guess one of the good things about our industry that's clear over the years is that it's extremely tight industry. You and I see each other over and over and over throughout the course of the year, and I'm sure you see many of your contacts over and over. And there is kind of an intimacy about the industry that people have described. So I'm hoping that those relationships are strong enough to withstand these financial pressures. And I think so. We just hope that the economy certainly comes around sooner rather than later, but we'll see.
I think that we in ophthalmology and let's say in the medical world, in medicine in general, we're still very lucky because in our specific case, people will still have cataracts. So when the pandemic is gone or slowed down, things will start going and we will start selling straight away. At least that's my expectations. Comparing to other industries where I can imagine that will take longer to recover. I don't know, just think about the tourism industry, for instance, who's going to be traveling where? Think about flying. That's going to be a huge problem for the Deltas, the KLMs, the Singapore Airlines. I think there's going to be less traveling. People need to work, there's less money, you're afraid of traveling. Are you going to buy a package in Havana or are you just going to stay at home? So I think those industries are going to take some more time to recover, the tourism, than for instance, our industry. So in that sense, we're better off than the rest.
Well, I'll confess, Tiago, I used to want to own an airline like Richard Branson, something like Pi or Cake Air. But now I figure those guys can keep the airlines. And ophthalmologists themselves, how do you hear they're faring these days? Are they just staying home and sort of getting by? What are they doing?
It depends on the countries. There's some countries that they ask or they require ophthalmologists even to general medicine because to help up the colleagues because, everything is full of corona patients. Some private clinics in some countries, they still do surgery. So I think it also depends if you're a surgeon working on a private clinic or if you're working into the public system. It's very diverse. Depends on what are you doing and which country are you. But for sure that you're not doing a lot of surgeries, that we know as a fact.
One thing that I just realized that you could probably speak to as well is how do you maintain a work-life balance in the home environment?
Well, you just got an example, right?
Yeah.
I'm having a conversation with you, and suddenly two kids came up. I'm sure when you hear this back, there's going to be some back noise. Sometimes maybe somebody screaming or crying or something like that.
Right.
But like I said, I'm not the only one. When I have these calls, many times it happens that a colleague or a surgeon or a doctor or a supplier has the same issue. So obviously, we all try to organize ourselves in the best way possible. I try to do it with my family, and I imagine the rest does the same. That your wife, your partner, or somebody can take care of the child for a certain moment, and you can work, and then you switch it around. Then you go take care of the children, and your partner
Yeah.
helps you. I mean, every case is different, obviously. Some people have grown-up children, that's not an issue. Others don't have children, there's not an issue at all, obviously. But for instance, in my case, there's no schooling, so we also have to be the teacher. So you have to be Tiago, the Offtech marketing director. You need to be Tiago, the teacher. You need to be Tiago, the cleaning guy at home, do the cooking, do the normal things. So I think in Corona times, you get more busy. You're busier, right? You can't
Yeah.
just go and grab some food around the corner because the restaurant is closed. You don't have anybody helping you in the house because that person is at home. The children are at home. So I think for everybody, it's complicated. And I'm glad, and I said it before, I'm glad that in the Netherlands we can still go out. And I have a garden, so I can go to the garden with the kids and we can walk outside. But in some countries you can't even do that. So that's terrible. How do you do it, Matt?
Honestly, I've had a different issue, because I haven't been in contact with anyone for more than a month now. But that means I'm running inside my own head all the time, and that can cause problems. So I need to balance, Matt, the personal person, with Matt, the work guy, with
Right.
Matt, the guy concerned about all kinds of, things about the world, the community, the family.
Obviously.
There's a lot of
Obviously.
talking heads going on in isolation, and that's what I have to deal with. Everybody gets through it differently, though, in terms of the isolation. I've heard things from my father who has said, Matt, you have to structure your day. You have to be
Right.
able to, more than ever. And honestly, I didn't do that. But what I am good at, which I realized, is that even if I start working at 2 p.m., I'm a maniac about it. I can go for a 12-hour stretch and then hang it up. So I think you find out more about yourself also being isolated, and that can make a stronger person eventually.
Agree. Matt, are you able to go outside or not? Just for buying groceries?
No, but soon I will be able to be released. I'm very much looking forward to that, for sure. I have been able to do some yoga, which I'd kind of getting away from, so that's a good new practice. Even the way I kind of start to think about storytelling again. I've become, strangely enough, I've become more of a journalist in the last 2 weeks because this is the story of our lifetimes, and anybody who's in the media right now, whether you're a publisher or a writer, somebody doing the paperwork, we're all thinking about the stories. And you were talking about ways to give back to the community in terms of the masks. Honestly, the best thing that we can do is just keep talking, keep getting information out, helping people get through this in terms of the ideas and the communications. So that's why I'm kind of doing this.
For sure, this is going to be a period that you're never going to forget for the rest of your life. In 10 years, we're
Yeah.
going to be talking like, hey, Tiago, do you remember about that time when this
Yeah.
happened? So everybody will have some kind of memories.
Yeah.
Unfortunately, for some people, the memories will be also very sad. We must not forget all the people that have passed away. That's very sad. Luckily, not in my family, but a lot of people have suffered from that. So I also take the opportunity, Matt, to extend here from our side the big thank you for the medical community and for everything that they're doing all over the world to all the patients. We see different manifestations in different countries in different ways. Cheering up for their work, and lots of them put their lives into danger. And so while we're talking here a little bit about business and the future, and that's very important, we also need to spend a minute like we're doing now, I think, thinking about the people that are working 24/7
to save lives, and many of them risking their lives to get contact with the virus and get themselves infected. So a big applause for those guys as well.
Yeah, I think it's an honor to work in the medical industry. We're not directly involved in that, but we know people who are. And it seems, like never before, healthcare is in a spotlight, and it's certainly an honor to work in the industry.
Agree, Mike. Agree, Matt.
By the way, the work-life balance, going to back, what are maybe Thiago's top 3 tips for getting through?
To getting through the crisis?
Yeah.
You mentioned some of the things to be structured, but it's so difficult to do that because when I look to myself, the biggest issue is the children. I think you need to think for yourself, how can I, certain moments of the day, distract or make sure that my children are busy doing something helpful for themselves and at the same time allowing me to perform the tasks that I need to perform. So it's very hard to give tips and tricks because I think it's so different from family to family, from person to person. I think you wanted a better, more constructive answer, but I don't know. It really depends on the situation, Matt.
Well, maybe this is more about empathy then, You have 3 kids, right? And you and your wife are both at home. Does she work as well?
Yes, full time.
She does. So you do have to kind of take turns. Do you find that you are taking certain hours and then you ask her to take certain hours? Is it like that?
That's how we try to do it. So I try to organize the calls at a certain time, and then she takes care of the children, and then we do the other way around. She does her calls, and I take care of the children. And then after they go to bed, then we still have to do other necessary things for the job. So you need to have some kind of structure in your daily tasks. I think that's the most important message.
I guess there's no such thing right now as a 9-to-5 job.
No, absolutely. You need to be, flexible. That's a good word. Be flexible. So you need to have a structure and at the same time be flexible. Wow, that's not
right.
easy.
And is the company understanding of that too, that you might
Absolutely.
not be in at 11, but you'll be there later?
We're absolutely delighted to have Offtech as an employee because they understand, they give you the freedom to do what you need to do when you can do it. And like I said in the beginning, they're worried about our health. And I think that's a very important point. Make sure that we're all healthy and everybody keeps the jobs. And that's priority number 1. And that brings me to the next one, Matt, which is my turn is going to start now at 1 p.m. So now it's my wife's turn to go on her Skypes.
Okay. Well, great, pal. Well, I thank you very much for joining us here, sharing some tips, a little about your life. I'd like to see the home of Thiago Guerreiro. All the best from us at Pie and Cake. Hope you have a great world once you leave isolation.
Thank you, man. Hey, thanks for everything. Thank you, everybody. And I hope to see you personally very soon. Keep healthy. Talk to you soon, man.
Okay, all the best, pal. See ya.
Cheers, mate.
Bye.
Bye.